Hello, today I'd like to talk to you about what to expect as a first-term GP registrar, because after several years in the hospital system, first as a medical student and then as a junior doctor, it can seem really daunting to take those steps out into general practice. So hopefully by giving you an idea of what to expect, it will make those first steps a bit easier. So when starting out with your training as a Term 1 GP registrar, you won't be thrown in at the deep end. Just like in hospital, you'll be provided with orientation to your practice. And I was really lucky in my first training practice because I got to sit in with the other GPs in the clinic and see their different consulting styles, see how the mechanics of the practice worked, and find out a bit about their special interests as well. So that was a really useful experience. You also will get orientation to the training programs themselves provided by the colleges. And again, that's really useful to set out what to expect over the next few years. A big myth in general practice is that the work is really isolating because you work alone, but I found that's just not the case. In my two training practices, I found them really collegial, and we had lots of meetings to talk about patients if we needed to talk about how the practice operated so that we could improve it, talk about new research coming out, all of those sort of things that keep the connection going with your colleagues, as well as just popping into each other's rooms from time to time if there was something interesting to see or talk about. And in the practices, you're also working with other staff like the nurses, the diabetes educators, other allied health that you might have within your practice. You'll have frequent contact with other medical and surgical specialists. So all points of contact that make the job not isolating at all. And the biggest member of the team in general practice is the patient, and having frequent consults over time allows you to really get to know the patient and make a difference in their lives, and it's a really rewarding experience. So it's important to remember that throughout your GP training you will have support along the way. Often a good first point of call is the GP supervisor in that training practice that you're in. But also the colleges have teams of people on the ground to help guide you through the training as well. So hopefully that's made you want to take the first step out into general practice. If you'd like to find out more information, please look at our website mccc.com.au and also our social media channels for further information. Thanks.